Our next speaker will be Joyce Jolliffe from Strathroy, and they've just a concerned citizens group, and they just formed not too long ago. In October.
Welcome.
Thank you, Joyce.
Well, I was like a lot of people in our community in Strathroy. They made the, first of all, we're not allowed in the board meetings. They're shut off from the public. So we really don't know what was going on. But they made the announcement that they were going to shut down the 4th floor. Well, that got everybody upset because we had people out there waiting to go to nursing homes, long-term care, and they were just going to shut them down with, no reason as to why, basically because of the budget, because they had to balance the budget. Well, I, like everybody else, thought, it's mismanagement of our money. It's the board that was doing this. I did not clue in to the LHIN. I didn't know anything really about the LHIN at that particular time. Joe wanted me and asked me to come with him to the meeting that you held here in Toronto. So I said, what the heck, being a retired steel worker, I thought, I'm going to go because I'm going to meet some of my friends and some of my brothers and sisters, and that was the main reason for going at that meeting. Well, I tell you, did I ever get my eyes open? I did not know what the LHINs were doing. I did not know that the board, our board, was shut to the public at that particular time. So I got really upset. I went home, talked to my husband, and told him, look, I've been stupid, I've been blind, and I should know better because I have been an advocate for our health care for forever and ever and ever. And that I said, we got to do something. So got a hold of Hadley. She was saying about the problems that we were having, and so I knew a lady that worked at the St. Thomas site in St. Thomas. She went through the restructuring at that time when the Harris government was planning on shutting that down. I went to her and then told her what was going on, and I said, we need to form our own group. We need to inform the public as to what was going on, what the LHIN was planning on doing. We need to get the people to understand that it's not our board that was doing it, because we were blaming the board, the hospital board. They're the ones that are mismanaging our money, and so we need to put stuff. So we formed our committee. Make a long story short, we formed our committee in October. We had a town hall meeting, and it was about 100 people came out. We had a doctor that came out to speak and talk about repercussion. This poor man has really went through, I don't want to say the word hell, but I'm going to say it, with people, with the LHIN. The repercussion has been terrible. His name has been on the hospital blog about speaking out about what's happening. I'm getting all worked up here. We formed a committee and we put letters in the paper. We've got a petition ready. We're meeting again with the town on the 9th. We've got sample letters ready to hand out to our public, because a lot of people won't sit and write letters. They don't know how to write letters. So we got sample letters sitting there waiting to hand them out. We're waiting to find out when the rally's going to take place in Toronto, because I think we need to have buses after buses after buses. I think we need to shut down Toronto and tell our MPPs and our government that you're not going to take away our health care. And that leads me into my closing statement. I worked with Hillary Clinton in early 90s when she was trying to bring in the universal health care in the States. We had a panel of Canadian women talking about our health care, and we had a panel of the American women telling their stories about what their family's going through. And I want you to think this is true, because if we don't fight back, it's going to happen to us. There was a lady from the U.S. got up to the microphone. She was about 25, 26 years old, and her father had cancer, and he needed treatment. Of course, they had no money. So they thought, well, okay, the money that they've saved over their lifetime, sell their house, sell everything that they have, they can give this man the treatment that he needed. So they did that. moved in with the daughter, sold everything they had with their savings. They had enough money to pay for the treatment. In that treatment, the wife came down. They diagnosed his wife with cancer. The family had to sit down and talk it out, who's going to get the treatment and who's not, because they had no money. They couldn't pay for both of them to have the treatment. The husband and wife of the family decided, we can't afford to save one, we're not going to save the other. And that family had to bury those two people just because they had no health care. We cannot let that happen here. We have to stand up and we have to fight.
Just to be able to say this, and I'm going to get thrown out the voting, I'm sure. You know, this is what community can do. I hear all the time that it's people like Joyce and the Helen Havlicks of the world who, you know, we go around in our communities and we start shaking trees. We hear all the time about how people are being harassed, they're being abused when they speak up in their workplaces or, you know, on their committees or councils or whatever. And it's people like us that can go out there, and we're not attached to anything. I don't have an employer that's going to threaten me with my job. So I urge you, please participate in your local health coalitions. They, for the most part, can be anonymous. We need your information and we need your support. And this is how we're going to win this fight.